12 News Eye on Agriculture with Britton Rucker.
Two Western Kansas doctors in a legal standoff with their hospital over non-compete agreements. Fact Finder investigates the case and its potential ripple effect on health care access for rural Kansas communities. Plus, a new way of livestock fence making strides and how new research at a K-State is diving into ear tags that go far beyond GPS tracking. And good evening and welcome back in Agriculture. I'm Britton Rucker. Avian flu continues to scramble the nationwide egg supply. Restaurants across the country dealing with a nationwide egg shortage. Many of them are having to raise their prices as a result. The shortage and higher prices are due to the bird flu outbreak. One cafe owner says it's especially difficult for breakfast restaurants where a large portion of their meals use eggs.
It's a little daunting going into a slow month, knowing it's going to be slower and also raising your price at the same time.
He says he plans on lowering prices again once the price of eggs go back down. It's unclear when egg prices will begin to fall, though. And contributing to those higher egg prices, chicken producers in Colorado now being required to provide a cage-free environment for birds. It impacts more than 3,000 hens. All eggs sold in the state must come from a cage-free facility. The law passed in 2020 and became enforceable January 1st. Giving local farmers time to prepare. The Food and Drug Administration now testing cheese made from raw cow's milk for potential bird flu contamination. At least 300 samples will be collected nationwide over the next 3 months. The search for the H5N1 virus is expanding after an outbreak in multiple states linked to raw milk and dairies. The National Institutes of Health says bird flu remains at a low risk to the general public. Two doctors in Western Kansas are working to find a peaceful resolution to federal lawsuits filed against HaysMed. They're trying to block the hospital from enforcing non-compete agreements, which prevent them from finding other employment in the area. Fact Finder investigator Sean Logging digs into the cases.
Out in Western Kansas, Dr. Donald Tillman has become very familiar with the landscape of health care.
There's an abundance of need. And if you think about your grandmother, where would you want to have your grandmother go? You'd rather have her stay in a local town.
He's been practicing in Hays for nearly 30 years, most of that time at Great Plains Dermatology.
We have a real difficult time recruiting to Western Kansas.
The candidates almost need to have been from this area in order to be able to recruit them, or from an area that's similar.
Charles Como, Rooks County Health Center Board Chair just north of Ellis County, and Dr. Tillman both say something else impacting rural health care are restrictive covenants or non-competes. Neither Rooks County Health Center or Great Plains Dermatology have restrictive covenants.
We lose somebody who's established in this community because of a restrictive covenant. It's a loss not only to Hays, but it's a loss for the rural communities that they have serviced for years and years and years.
If it's a primary care physician, we lose that person who is able to facilitate health care in a rural area.
Dr. Tillman has experience with this topic, previously challenging his covenant in the 90s to continue practicing in Hays, and after a legal fight, buying his way out. A few years later, he opened Great Plains Dermatology.
There is no good reason for rural America to have any restrictive covenant.
While some states ban restrictive covenants on healthcare workers, Kansas isn't one of them. Non-competes exist, so when a provider leaves, they are limited to where they can't work, at least for a period of time. HaysMed's board of directors, in a December 5th statement addressing the hospital's use of them after the departure of some doctors, brought this topic to the forefront. That statement saying, in part, this has been our practice since the early 1990s, which has served HaysMed and our patients well by enabling HaysMed to provide assurances to our patients that the hospital and its clinics have the medical staff and expertise to provide needed care. HaysMed says that this also reflects the investment they've made into staff. In lawsuits filed by General Surgeon Dr. Jared Grove and oncologist Dr. Robert Rodriguez to prevent enforcement of their covenants, it says their non-compete extends 110 miles around Hays, and also an additional 30 miles from any hospital where they did outreach for HaysMed. Part of both doctors' argument is the limited number of providers of their specialty in Western Kansas for why their restrictions shouldn't be enforced. The hospital, in response and counterclaim to Dr. Grove's suit, says there remain communities in western Kansas he can still work outside of his covenant, providers of his specialty to serve patients, and that Dr. Grove previously served on the Hayes Med board, making him aware of confidential information.
The restricted covenants are not required to be enforced. They're not required to have in a contract, but it's only there to preserve financial assets.
For those who aren't supportive of these covenants,
it's very detrimental for rural Kansas.
They say patients feel the biggest impact.
I lost my oncologist and my pulmonologist in the same week. And when I get a new oncologist, it will have been my fifth that I've actually had.
In a letter discussing finding a resolution with the hospital, Dr. Grove and Dr. Rodriguez say our collective goal is to find a solution that benefits everyone involved, Hayes Med, ourselves, and most importantly, the community we serve.
Now, earlier this year, the FTC issued a rule to ban non-competes, but that has been put on hold after a legal challenge. Now, business groups say they're needed to protect business relationships, trade secrets, and investments in employees. Still ahead on Eye on Agriculture, bird flu could be affecting more than just poultry, flocks, and cattle. The worry some health experts have about the spread of the virus. Just ahead on Eye on Agriculture.